I passed my phlebotomy certification exam. Question 1. What is the function of the thixotropic gel inside an SST or PSD tube? Option A. To accelerate the coagulation cascade. Option B. To form a physical barrier between cells and serum/plasma during centrifugation. Option C. To preserve glucose levels for up to 24 hours. Option D. To chelate calcium and prevent fibrin formation. The correct answer is option B. To form a physical barrier between cells and serum/plasma during centrifugation. Thixotropic gel moves during centrifugation to create a stable barrier between the cells and the serum or plasma. This separation limits ongoing cellular metabolism and analyte exchange after spinning. The gel does not act as the anticoagulant or the clot activator. Question 2. What type of isolation room requires the air pressure to be lower than the surrounding hallway air pressure? Option A. Negative pressure isolation room, airborne precautions. Option B. Positive pressure isolation room, protective isolation. Option C. Standard contact isolation room. Option D. Droplet precaution room. The correct answer is option A. Negative pressure isolation room, airborne precautions. Airborne isolation uses negative room pressure so contaminated air flows into the room rather than out to the hallway. This helps contain airborne pathogens such as tuberculosis, measles, or varicella. Protective isolation for immunocompromised patients often uses positive pressure instead. Question 3. If a phlebotomist notices that a patient's name on an ID band matches the requisition, but the medical record numbers are different, what should they do? Option A. Draw the specimen and cross out the number on the tube label. Option B. Proceed with the draw as long as the alphabetical spelling of the name is correct. Option C. Do not collect the specimen until the discrepancy is resolved by admissions or nursing staff. Option D. Ask the patient which number is the correct one to use. The correct answer is option C. Do not collect the specimen until the discrepancy is resolved by admissions or nursing staff. Matching names are not enough when medical record numbers conflict. The specimen must not be collected until the discrepancy is resolved by appropriate staff. Asking the patient to choose a number or editing labels manually can create a serious identification error. Question 4. What is the clinical name for the thin, white layer of cells that forms between the plasma and red blood cells when an anticoagulated blood sample is centrifuged? Option A. Serum layer. Option B. Buffy coat. Option C. Fibrin web. Option D. Thrombotome. The correct answer is option B. Buffy coat. The buffy coat is the thin whitish layer between plasma and red cells after centrifuging anticoagulated blood. It contains leukocytes and platelets. Serum, fibrin, and clot material are associated with different specimen states. Question 5. Which of the following procedures requires a strict chain of custody documentation form to accompany the sample? Option A. Routine cholesterol screen. Option B. Workplace drug testing. Option C. Blood culture for endocarditis. Option D. Complete blood count for anemia. The correct answer is option B. Workplace drug testing. Workplace drug testing requires chain of custody documentation because results may have legal or employment consequences. The form tracks the specimen from collection through analysis and reporting. Routine cholesterol, CBC, or culture specimens do not usually require forensic level tracking. Question 6. What type of sample is collected during a therapeutic phlebotomy procedure? Option A tiny capillary tube for microhematocrit checking. Option B. A large unit of blood, typically 450 to 500 ml, to treat conditions like polycythemia vera. Option C. A series of 3 blood culture bottles over 24 hours. Option D. An arterial sample for gas analysis. The correct answer is option B. A large unit of blood, typically 450 to 500 ml, to treat conditions like polycythemia vera. Therapeutic phlebotomy removes a large volume of blood, often about 450 to 500 ml, to reduce red cell mass or iron burden. It may be used for conditions such as polycythemia vera or hemochromatosis under provider order. It is different from diagnostic venipuncture, which collects small specimen volumes. Question 7. What is the correct order of draw when collecting a blood culture, a chemistry SSD, and a sodium citrate tube using a multisample needle system? Option A, SST, light blue, blood culture. Option B, blood culture, light blue, SST. Option C, light blue, SST, blood culture. Option D, blood culture, SST, light blue. The correct answer is option B, blood culture, light blue, SST. Blood cultures are drawn first, followed by light blue citrate tubes and then serum tubes such as SST. This sequence protects culture sterility and reduces additive carryover into coagulation specimens. Drawing SST before citrate can introduce clot activator or gel-related contamination risk. Question 8. Which of the following scenarios describes the correct patient preparation for an oral glucose tolerance test, OGTT? Option A. The patient should eat a low-carbohydrate diet for 3 days prior to the test. Option B. The patient must fast for at least 8 to 12 hours before the baseline draw is performed. Option C. The patient should exercise vigorously right before drinking the glucose solution. Option D. The patient can drink black coffee or tea during the hours of the testing period. The correct answer is option B. The patient must fast for at least 8 to 12 hours before the baseline draw is performed. An OGTT begins with a fasting baseline specimen, usually after 8 to 12 hours without caloric intake. Food, coffee, or strenuous exercise can alter glucose metabolism and invalidate the test. A low-carbohydrate diet before testing can also distort the response to the glucose load. Question 9. What type of patient environment requires protective, reverse, isolation protocols? Option A patient with an active, contagious respiratory flu virus. Option B. A patient with an open, draining MRSA wound infection. Option C. A patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Option D. A patient with suspected food poisoning or viral gastroenteritis. The correct answer is option C. A patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Protective or reverse isolation is used for patients with severely weakened immune systems. The goal is to protect the patient from microorganisms carried by staff, visitors, and the environment. Patients with contagious infections generally require standard, contact, droplet, or airborne precautions instead. Question 10. Which of the following tests is used to monitor a patient's heparin therapy? Option A, prothrombin time, patient. Option B, activated partial thromboplastin time, APTT. Option C, hemoglobin A1c. Option D, rheumatoid factor, RF. The correct answer is option B, activated partial thromboplastin time, APTT. APTT evaluates the intrinsic pathway and is commonly used to monitor unfractionated heparin therapy. Heparin affects clotting factors measured by this pathway. Patient is more associated with warfarin monitoring, while HbA1c and rheumatoid factor are unrelated to heparin dosing. Question 11. Which of the following tests requires a 24-hour urine collection? Option A, culture and sensitivity, C&S. Option B, creatinine clearance. Option C, routine chemical urinalysis. Option D, pregnancy HCG confirmation. The correct answer is option B, creatinine clearance. Creatinine clearance testing often requires a 24-hour urine collection to measure renal clearance over time. The timed urine result is usually paired with a blood creatinine level. Routine urinalysis, pregnancy testing, and cultures use different urine collection methods. Question 12. Chain of custody protocols are required for which type of laboratory specimens? Option A, routine lipid panels. Option B, therapeutic drug monitoring. Option C, paternity and forensic drug testing. Option D, blood cultures for sepsis. The correct answer is option C, paternity and forensic drug testing. Chain of custody is required when the specimen may be used as legal evidence or to establish identity. Forensic drug testing and paternity testing require documentation of collection, handling, transfer, and receipt. Routine clinical tests do not usually require that level of legal tracking. Question 13. What does a trough level measure in therapeutic drug monitoring, TDM? Option A. The highest concentration of the drug in the patient's system. Option B. The lowest concentration of the drug, measured right before the next dose. Option C. The average concentration of the drug over a 24-hour window. Option D. The amount of drug excreted through the kidneys. The correct answer is option B. The lowest concentration of the drug, measured right before the next dose. A trough level measures the lowest drug concentration, usually just before the next scheduled dose. Timing is critical because the result guides dosing safety and therapeutic effectiveness. Peak levels measure the highest concentration after dosing and answer a different clinical question. Question 14. What is the proper clinical intervention if a hematoma forms rapidly under the skin while you are drawing a patient's blood? Option A. Press down hard on the needle to flatten out the swelling. Option B. Release the tourniquet immediately, pull the needle out, and apply firm pressure to the site. Option C. Switch to a larger vacuum tube to pull the pooled blood out of the tissue. Option D. Continue the draw until all ordered tubes are filled completely. The correct answer is option B. Release the tourniquet immediately, pull the needle out, and apply firm pressure to the site. Rapid hematoma formation means blood is escaping into tissue during the draw. The tourniquet should be released, the needle removed, and firm pressure applied to stop the bleeding. Continuing the collection or trying to drain the swelling through the tube can worsen injury. Question 15. Which of the following conditions describes a vein that feels hard, cord-like, and lacks resiliency? Option A. Patent vein. Option B. Sclerosed vein. Option C. Superficial vein. Option D. Tortuous vein. The correct answer is option B. Sclerosed vein. A sclerosed vein feels hard, cord-like, and poorly resilient because of scarring or repeated irritation. Such veins may not accept a needle well and can yield poor flow. A patent vein is open and resilient, while tortuous veins are winding rather than necessarily hardened. Question 16. Which of the following factors can lead to hemoconcentration during a blood draw? Option A. Releasing the tourniquet as soon as blood flow is established. Option B. Allowing the patient to pump their fist repeatedly and forcefully. Option C. Positioning the patient's arm downward during the procedure. Option D. Using a large bore needle on a deep, patent vein. The correct answer is option B. Allowing the patient to pump their fist repeatedly and forcefully. Forceful or repeated fist pumping during tourniquet application increases local muscle activity and venous stasis. This can concentrate analytes and falsely elevate potassium or other chemistry values. The patient may make a fist, but continuous pumping should be avoided. Question 17. What type of vessel contains thick, muscular walls and carries blood away from the heart under high pressure? Option A. Vein. Option B. Artery. Option C. Capillary. Option D. Venule. The correct answer is option B. Artery. Arteries have thick, muscular, elastic walls that carry blood away from the heart under pressure. This structure allows them to tolerate pulsatile pressure generated by ventricular contraction. Veins return blood at lower pressure and often contain valves. Question 18. Which of the following tests evaluates the extrinsic coagulation pathway and is commonly monitored in patients taking oral warfarin therapy? Option A. Activated partial thromboplastin time, APTT. Option B. Prothrombin time / international normalized ratio, patient / INR. Option C. Bleeding time determination. Option D. Complete blood count, CBC. The correct answer is option B. Prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic pathway and are commonly used to monitor oral warfarin therapy. Warfarin affects vitamin K-dependent clotting factors that influence this test. APTT is used more often for heparin therapy and the intrinsic pathway. Question 19. What type of vessel links the smallest arteriole pathways with the smallest venule pathways? Option A. Capillary. Option B. Sinusoid. Option C. Lymph duct. Option D. Deep artery. The correct answer is option A. Capillary. Capillaries connect arterioles and venules and provide the main exchange surface between blood and tissues. Their thin walls allow movement of gases, nutrients, and wastes. Arteries and lymph ducts perform different transport functions. Question 20. What occurs during the pre-analytical phase of laboratory operations? Option of running standard controls on a chemistry profile machine. Option B. All processes involved in patient identification, collection, handling, and transport prior to actual sample analysis. Option C. Interpreting a bone marrow biopsy under a microscope. Option D. Transmitting final electronic medical record entries to billing. The correct answer is option B. All processes involved in patient identification, collection, handling, and transport prior to actual sample analysis. The pre-analytical phase includes everything that happens before actual testing, including orders, patient identification, collection, handling, and transport. Many laboratory errors occur in this phase because specimen quality is established before analysis begins. Analyzer operation and result reporting belong to later phases. Question 21. Which of the following tests requires a plain red top tube with no gel or additives? Option A. Complete blood count, CBC. Option B. Type and screen. Option C. Certain therapeutic drug levels that bind to gel barriers. Option D. Plasma glucose tracking. The correct answer is option C. Certain therapeutic drug levels that bind to gel barriers. Some therapeutic drugs can bind to separated gel or be affected by tube additives. A plain red top tube without gel is used when the test requires serum free from gel interference. CBC, blood bank testing, and plasma glucose monitoring use different specimen types. Question 22. Which of the following statements matches the correct definition of assault? Option A. Unjustified or unconsented physical contact with another person. Option B. The intentional threat or attempt to cause bodily harm, creating fear in the patient. Option C. Revealing confidential medical findings to unauthorized personnel. Option D. Mislabeling a laboratory specimen tube by accident. The correct answer is option B. The intentional threat or attempt to cause bodily harm, creating fear in the patient. Assault is an intentional threat or attempt that makes a patient fear harmful contact. No physical touching is required for assault to occur. Battery involves unauthorized touching, and confidentiality breaches involve private information rather than threatened harm. Question 23. What is the standard depth of a lancet puncture used for a fingerstick on an adult patient? Option of 1.0 to 1.5 mm. Option B 1.8 to 2.4 mm. Option C 3.0 to 4.0 mm. Option D 4.5 to 5.0 mm. The correct answer is option B 1.8 to 2.4 mm. Adult fingerstick lancets generally penetrate about 1.8 to 2.4 mm. This depth reaches the capillary bed while limiting injury to deeper structures. Shallower punctures may not provide adequate flow, and deeper punctures can cause unnecessary trauma. Question 24. Which of the following items is classified as a biohazard and must be disposed of in a rigid sharps container? Option A clean, unused plastic tube holder. Option B. A blood-soaked gauze pad. Option C. A used lancet device from a heel stick. Option D. The paper backing from an adhesive bandage. The correct answer is option C. A used lancet device from a heel stick. A used lancet is a contaminated sharp and must be placed in a rigid sharps container. Sharps disposal prevents puncture injury and blood-borne pathogen exposure. Gauze may be biohazardous if saturated, but it does not belong in a sharps container unless it contains a sharp. Question 25. Which gauge needle has the smallest lumen diameter? Option A 18 gauge. Option B 21 gauge. Option C 23 gauge. Option D 25 gauge. The correct answer is option D 25 gauge. Needle gauge is inversely related to lumen size, so higher gauge numbers have smaller openings. A 25 gauge needle has the narrowest lumen among the listed sizes. Smaller lumens can increase hemolysis risk when used for routine venipuncture. Question 26. Which of the following conditions can lead to a lipemic specimen? Option A. The patient did not fast before a lipid panel draw. Option B. The specimen was hemolyzed during collection. Option C. The tube was left under direct light for too long. Option D. The patient was severely dehydrated. The correct answer is option A. The patient did not fast before a lipid panel draw. Lipemia often occurs when blood is drawn after recent dietary fat intake, especially before lipid testing. The serum or plasma may look cloudy or milky from circulating lipoproteins. Hemolysis causes a red tint, while icterus produces a yellow to amber color. Question 27. What is the primary purpose of applying a tourniquet during a venipuncture procedure? Option A. To stop the arterial blood flow to the limb. Option B. To engorge the veins and make them more palpable. Option C. To anchor the vein and prevent it from rolling. Option D. To ensure the sterility of the puncture site. The correct answer is option B. To engorge the veins and make them more palpable. A tourniquet temporarily slows venous returns so veins become fuller, easier to see, and easier to palpate. It should not stop arterial flow or be tightened enough to injure the patient. Vein anchoring and skin antisepsis are separate steps with different purposes. Question 28. If a phlebotomist must collect blood from a patient with an active, running foreline in both arms, what is the preferred option? Option A. Draw the blood from a capillary puncture if the tests allow. Option B. Turn off the for yourself and draw above the line immediately. Option C. Draw from the foot or ankle without a physician's order. Option D. Postpone the draw indefinitely until the patient is discharged. The correct answer is option A. Draw the blood from a capillary puncture if the tests allow. When both arms have running forelines, venous sampling near either infusion may be diluted or contaminated. If the ordered tests permit capillary collection, skin puncture can avoid the active infusion sites. Turning off force or using lower extremity veins requires nursing or provider direction and facility policy. Question 29. Which of the following options describes the best method to prevent a vein from rolling during needle insertion? Option A. Tying the tourniquet directly over the intended puncture site. Option B. Anchoring the vein firmly by pulling the skin taut downward with the thumb below the site. Option C. Having the patient pump their fist continuously during needle insertion. Option D. Inserting the needle quickly at a sharp 90-degree angle. The correct answer is option B. Anchoring the vein firmly by pulling the skin taut downward with the thumb below the site. Anchoring pulls the skin taut below the puncture site to stabilize the vein. This prevents rolling and allows a controlled needle entry. Tying the tourniquet over the site, fist pumping, or using a steep angle can increase injury or specimen problems. Question 30. What does the term basal state refer to in clinical laboratory testing? Option A. The condition of the body early in the morning, resting and fasting for roughly 12 hours. Option B. The physical state of the body directly following a heavy workout session. Option C. The point of highest metabolic activity in the afternoon. Option D. The body state while under heavy psychological stress. The correct answer is option A. The condition of the body early in the morning, resting and fasting for roughly 12 hours. Basal state refers to the body's resting condition after fasting, usually early in the morning. This state reduces the effects of recent meals, exercise, stress, and daily variation on laboratory values. Heavy activity or psychological stress can significantly alter some analytes. Question 31. Which of the following legal terms is defined as the unauthorized, harmful, or offensive touching of another individual? Option A. Assault. Option B. Battery. Option C. Defamation. Option D. Malpractice. The correct answer is option B. Battery. Battery is unauthorized, harmful, or offensive physical contact with another person. In phlebotomy, drawing blood without valid permission can constitute battery. Assault involves threat or fear of contact rather than the contact itself. Question 32. Which of the following values represents a panic or critical laboratory value that must be reported immediately? Option A. A fasting glucose of 90 mg/dl. Option B. A potassium level of 2.1 mg/L. Option C. A total cholesterol level of 210 mg/dl. Option D. A white blood cell count of 7,500/mcl. The correct answer is option B. A potassium level of 2.1 mg/L. A potassium level of 2.1 mg/L is critically low and can cause dangerous cardiac rhythm disturbances. Critical values must be reported immediately according to facility policy. Normal glucose or white blood cell values do not require urgent panic notification. Question 33. Which of the following variables can cause a specimen to appear cloudy or milky white after centrifugation? Option A. High levels of lipids, fats, circulating in the blood. Option B. Extensive hemolysis from using a small needle. Option C. Elevated levels of direct and indirect bilirubin. Option D. Failure to mix an anticoagulant tube after drawing. The correct answer is option A. High levels of lipids, fats, circulating in the blood. High circulating lipid content produces a cloudy or milky serum or plasma appearance after centrifugation. This condition is called lipemia and may interfere with optical laboratory methods. Hemolysis creates red discoloration, while icterus creates yellow discoloration. Question 34. What should a phlebotomist do if they notice that the expiration date on a vacuum collection tube has passed? Option A. Use the tube anyway if it is the only one available on the tray. Option B. Discard the expired tube and select a current, unexpired tube from inventory. Option C. Assume the additive inside is still functional for another 6 months. Option D. Write the current date over the expiration date on the label. The correct answer is option B. Discard the expired tube and select a current, unexpired tube from inventory. Expired vacuum tubes may have reduced vacuum, degraded additives, or compromised sterility. They should be discarded and replaced with unexpired tubes from inventory. Using an expired tube can cause short draws, clotting, contamination, or inaccurate results. Question 35. What color top tube contains the additive EDTA and is used for molecular diagnostic testing and viral load checks? Option A. Pearl/white top with gel barrier. Option B. Light blue top. Option C. Gray top. Option D. Yellow top with SPS. The correct answer is option A. Pearl/white top with gel barrier. Pearl or white top tubes commonly contain EDTA with a gel barrier for molecular diagnostic tests such as viral load testing. EDTA helps preserve nucleic acid stability and prevents clotting. Light blue, gray, and yellow SPS tubes serve coagulation, glucose, or culture-related purposes. Question 36. Which of the following additives is found in a yellow top blood culture tube? Option A. Sodium polyethylene sulfonate, SPS. Option B. Acid citrate dextrose, ACD. Option C. Dethylenediamine tetracetic acid, EDTA. Option D. Sodium citrate. The correct answer is option A. Sodium polyethylene sulfonate, SPS. Yellow blood culture tubes contain SPS, which supports organism recovery by limiting complement and phagocytic activity. It also provides anticoagulation for the culture specimen. ACD yellow tubes are different and are used for cellular or genetic testing. Question 37. Which of the following tubes contains no additives or gel barriers and is often used as a discard tube or for specialized serum testing? Option A. Clear or plain red glass top. Option B. Light blue top. Option C. Lavender top. Option D. Light green top. The correct answer is option A. Clear or plain red glass top. Clear or plain red glass tubes contain no additive or gel and may be used as discard tubes or for selected serum testing. They are useful when additive carryover must be avoided. Colored additive tubes contain substances that can interfere with tests not designed for them. Question 38. Which of the following conditions is an example of an autoimmune or hematological test commonly drawn in a lavender tube? Option A. Prothrombin time, patient. Option B. Erythrocyte sedimentation rate, ESR. Option C. Basic metabolic panel, BMP. Option D. Blood culture series. The correct answer is option B. Erythrocyte sedimentation rate, ESR. ESR is commonly collected in an EDTA tube because the test evaluates red cell settling in anticoagulated blood. Lavender tubes preserve cellular components and prevent clotting. Coagulation and chemistry tests require different tubes and additives. Question 39. What is the correct angle of insertion for a standard multisample needle during a venipuncture? Option A, 5 to 10 degrees. Option B, 15 to 30 degrees. Option C, 45 to 60 degrees. Option D, 90 degrees. The correct answer is option B, 15 to 30 degrees. A standard straight needle is usually inserted at a shallow 15 to 30 degree angle to enter the vein smoothly. This angle helps avoid passing through the vein or striking deeper structures. Very shallow angles can miss the lumen, while steep angles increase tissue trauma. Question 40. What should a phlebotomist do if they note that an inpatient's identification band is attached to the bed rail instead of the patient's body? Option A, scan the band on the bed rail and proceed with the draw. Option B, refuse to perform the venipuncture until a nurse verifies identity and attaches a new ID band directly onto the patient's body. Option C, ask the patient's visitor to confirm that the band belongs to the patient. Option D, cross out the name on the band and write it on a new tube label. The correct answer is option B, refuse to perform the venipuncture until a nurse verifies identity and attaches a new ID band directly onto the patient's body. An ID band attached to the bed rail does not reliably identify the patient. The phlebotomist should not collect until nursing staff verifies identity and attaches a proper band to the patient. Scanning or using a detached band creates a wrong patient risk. Question 41. Which of the following steps is part of the proper protocol for performing a newborn screening? PKU. Collection. Option A, layering multiple drops of blood onto a single filter paper circle. Option B, touching the filter paper directly to the infant's heel puncture site to absorb blood into the circles. Option C, using a capillary tube to collect blood and then smearing it across the card. Option D, wiping the filter paper card with isopropyl alcohol before applying blood. The correct answer is option B, touching the filter paper directly to the infant's heel puncture site to absorb blood into the circles. Newborn screening cards should be filled by allowing blood to soak directly from the heel drop into the filter paper circles. The paper should not be pressed hard against the skin or layered repeatedly. Proper saturation through the paper is essential for valid screening. Question 42. What is the standard duration for an administrative scrub or hand washing when preparing for routine patient contact? Option A, 5 seconds. Option B, 20 seconds. Option C, 1 minute. Option D, 3 minutes. The correct answer is option B, 20 seconds. Routine hand washing before patient contact should last at least 20 seconds. This duration allows adequate friction and contact time to remove transient microorganisms. Very brief washing is ineffective, while surgical scrub times are reserved for different procedures. Question 43. Which of the following tests measures the average blood glucose concentration over the past 2 to 3 months? Option A, fasting blood sugar, FBS. Option B, oral glucose tolerance test, OGTT. Option C, hemoglobin A1C, HbA1c. Option D, postprandial glucose test. The correct answer is option C, hemoglobin A1C, HbA1c. Hemoglobin A1c reflects the percentage of hemoglobin that has glucose attached over the lifespan of red blood cells. It estimates average blood glucose over roughly 2 to 3 months. Fasting and postprandial glucose tests measure glucose at a specific point in time. Question 44. If a phlebotomist notices a hematoma beginning to form during a blood draw, what action should be taken immediately? Option A, adjust the depth of the needle to stop the swelling. Option B, remove the tourniquet, withdraw the needle, and apply firm pressure. Option C, advance the needle further to bypass the hematoma. Option D, request the patient to pump their fist to redistribute the blood. The correct answer is option B, remove the tourniquet, withdraw the needle, and apply firm pressure. A developing hematoma means blood is leaking into surrounding tissue, so collection should stop at once. Releasing the tourniquet, withdrawing the needle, and applying firm pressure limits bleeding and tissue damage. Advancing the needle or continuing the draw can enlarge the hematoma and increase patient injury. Question 45. What is the function of the systemic circulatory system? Option A, moving blood exclusively between the heart and the lungs for gas exchange. Option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Option C, filtering liquid waste products through the nephron beds of the kidneys. Option D, producing white blood cells within the flat bones of the axial skeleton. The correct answer is option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Systemic circulation delivers oxygenated blood and nutrients from the left side of the heart to body tissues. It also returns deoxygenated blood and metabolic waste products back toward the right side of the heart. Pulmonary circulation is limited to blood flow between the heart and lungs. Question 46. A patient under contact precautions requires a blood draw. Which of the following personal protective equipment, PPE, must the phlebotomist don before entering the room? Option A, N95 respirator and gloves. Option B, gown and gloves. Option C, surgical mask and face shield. Option D, gown, mask, and goggles. The correct answer is option B, gown and gloves. Contact precautions require barrier protection against organisms spread by direct touch or contaminated surfaces. Gown and gloves protect clothing and hands before entering the room and should be removed according to facility procedure before exit. Respirators are reserved for airborne hazards, while masks and eye protection are added when splash or droplet exposure is expected. Question 47. What type of consent is required before a phlebotomist can draw blood from a minor child? Option A, implied consent from the child's teacher. Option B, informed or expressed consent from a parent or legally authorized guardian. Option C, no consent is needed as long as a doctor ordered the test. Option D, verbal consent from the minor patient themselves. The correct answer is option B, informed or expressed consent from a parent or legally authorized guardian. A minor generally requires consent from a parent or legally authorized guardian before routine blood collection. The child should still receive age-appropriate explanation and cooperation should be sought when possible. A physician order alone does not eliminate consent requirements. Question 48. What is the correct protocol for an inpatient who is sleeping when the phlebotomist arrives to draw blood? Option A, draw the blood quietly without waking them up to minimize pain. Option B, gently wake the patient, identify them properly, and explain the procedure before proceeding. Option C, skip the patient and mark them as unavailable on the computer. Option D, ask the patient's roommate to confirm their identity for you. The correct answer is option B, gently wake the patient, identify them properly, and explain the procedure before proceeding. A sleeping inpatient must be awakened and identified before collection. The phlebotomist should explain the procedure and obtain cooperation when possible. Drawing quietly without waking the patient prevents proper identification and consent. Question 49. Which of the following is an example of an analytical component of quality assurance? Option A, double-checking patient identity wristbands. Option B, ensuring proper maintenance and calibration of automated laboratory equipment. Option C, delivering critical panic results to a physician on time. Option D, labeling the collection tubes at the bedside. The correct answer is option B, ensuring proper maintenance and calibration of automated laboratory equipment. Analytical quality assurance involves the testing process itself, including instrument maintenance, calibration, controls, and reagent performance. These activities ensure measured results are reliable. Patient identification and bedside labeling are pre-analytical steps, while reporting results is post-analytical. Question 50. If a patient feels faint during a draw and has already passed out, what is the best position to place them in once safety measures are met? Option A, prone position. Option B, high Fowler's position. Option C, supine with legs elevated or flat. Option D, standing upright with assistance. The correct answer is option C, supine with legs elevated or flat. After immediate safety steps, a fainted patient should be placed flat or supine with legs elevated when appropriate. This position helps restore blood flow to the brain and reduces injury risk. Standing or sitting upright can worsen syncope and lead to falls. Question 51. What clinical term describes a systemic infection caused by pathogenic microorganisms or their toxins circulating in the bloodstream? Option A, hematoma. Option B, sclerosis. Option C, septicemia. Option D, petechiae. The correct answer is option C, septicemia. Septicemia is a systemic bloodstream infection caused by pathogenic microorganisms or their toxins. It is clinically serious because organisms and inflammatory mediators circulate throughout the body. Hematoma, sclerosis, and petechiae describe local bleeding or vessel conditions rather than systemic infection. Question 52. What is the primary purpose of the laboratory's safety data sheets, SDS? Option A, to track the daily attendance and performance records of employees. Option B, to provide detailed information regarding chemical hazards, handling, and first aid measures. Option C, to schedule the preventative maintenance routines for centrifuge machines. Option D, to log the critical panic values reported to physicians. The correct answer is option B, to provide detailed information regarding chemical hazards, handling, and first aid measures. Safety data sheets provide essential information about chemical hazards, safe handling, storage, spill response, and first aid. They support employee safety and emergency response in the laboratory. They do not track attendance, equipment schedules, or critical value reporting. Question 53. According to the Clinical and Laboratory Standards Institute, CLSI, which tube must be collected first in the standard order of draw? Option A, light blue top. Option B, lavender top. Option C, blood culture vials. Option D, green top. The correct answer is option C, blood culture vials. Blood culture bottles are collected before other tubes to protect sterility and prevent additive contamination from later tubes. This order is especially important because even minor contamination can affect organism recovery and antibiotic decisions. Coagulation, hematology, and chemistry tubes follow later because their additives can interfere if carried into cultures. Question 54. What is the primary function of the anticoagulant EDTA? Option A, it enhances the action of thrombin. Option B, it binds calcium ions, preventing the clotting cascade from activating. Option C, it destroys white blood cells to preserve red cells. Option D, it stabilizes glucose levels by stopping cellular glycolysis. The correct answer is option B, it binds calcium ions, preventing the clotting cascade from activating. EDTA binds calcium ions and prevents the coagulation cascade from progressing. This preserves whole blood for hematology testing and maintains cell morphology. It does not preserve glucose or accelerate clotting. Question 55. What is the primary medical reason for avoiding the basilic vein for routine venipuncture procedures whenever possible? Option A, the vein is too small to yield an adequate sample volume. Option B, the vein is located in close anatomical proximity to the brachial artery and the median nerve. Option C, the vein has a high tendency to collapse under normal vacuum tube pressure. Option D, the vein lacks a sufficient path to the superior vena cava system. The correct answer is option B, the vein is located in close anatomical proximity to the brachial artery and the median nerve. The basilic vein is avoided for routine draws because it lies close to the brachial artery and median nerve. Injury in that area can cause significant bleeding or nerve symptoms. Safer veins should be selected first whenever they are available. Question 56. Which of the following is an example of an implied consent scenario? Option A patient signs a formal document for an invasive procedure. Option B, an unconscious emergency room patient requiring urgent diagnostic lab work. Option C, a patient verbally states they agree to the blood test. Option D, a parent signs a waiver for their underage child. The correct answer is option B, An unconscious emergency room patient requiring urgent diagnostic lab work. In an emergency, an unconscious patient may be treated under implied consent when urgent diagnostic information is needed. The law generally recognizes that a reasonable person would consent to necessary care to prevent harm. This differs from a signed consent form or a routine verbal agreement. Question 57. What should a phlebotomist do if a patient begins to have a grand mal seizure during a venipuncture? Option A. Hold the needle steady inside the vein to complete the draw. Option B. Remove the needle and tourniquet immediately. Safeguard the patient from injury, and call for medical help. Option C. Place a wooden tongue depressor inside the patient's mouth to protect their tongue. Option D. Restrain the patient's arms firmly against the drawer chair to stop all movement. The correct answer is option B. Remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help. A seizure during venipuncture requires immediate removal of the needle and tourniquet to prevent injury. The patient should be protected from surrounding hazards and medical help should be called. Restraining the patient or placing objects in the mouth can cause harm. Question 58. A fasting specimen requires that the patient does not consume food or beverages, except water, for how many hours prior to collection? Option A. 2 to 4 hours. Option B. 4 to 6 hours. Option C. 8 to 12 hours. Option D. 18 to 24 hours. The correct answer is option C. 8 to 12 hours. Many fasting specimens require 8 to 12 hours without food or beverages other than water. This window helps remove recent dietary effects on glucose, lipids, and related analytes. Shorter fasting may not stabilize results, while much longer fasting can create other metabolic changes. Question 59. Which of the following tests is part of a routine liver function panel? Option A. Creatinine. Option B. Alanine aminotransferase, ALT. Option C. Hemoglobin A1c. Option D. Troponin I. The correct answer is option B. Alanine aminotransferase, ALT. ALT is a liver-associated enzyme included in routine liver function evaluation. It helps assess hepatocellular injury when interpreted with other liver markers. Creatinine, HbA1c, and troponin are associated with kidney function, glucose control, and cardiac injury rather than a standard liver panel. Question 60. What is the clinical purpose of performing a bleeding time test? Option A. To evaluate the integrity of the intrinsic coagulation pathway. Option B. To assess platelet function and the capillary bed's ability to form a primary plug. Option C. To measure the absolute concentration of fibrinogen molecules in plasma. Option D. To screen the body for active systemic bacterial infections. The correct answer is option B. To assess platelet function and the capillary bed's ability to form a primary plug. Bleeding time assesses platelet function and the ability of small vessels to form a primary hemostatic plug. It reflects platelet-vessel interaction rather than the intrinsic or extrinsic coagulation pathways. Coagulation factor problems are better evaluated with tests such as patient or APTT. Question 61. What type of vessel carries oxygenated blood away from the heart to the systemic tissues? Option A. Artery. Option B. Vein. Option C. Capillary. Option D. Venule. The correct answer is option A. Artery. Systemic arteries carry oxygenated blood away from the heart to body tissues. They operate under higher pressure and have thicker walls than veins. The pulmonary artery is an exception because it carries deoxygenated blood to the lungs. Question 62. Why is a royal blue top tube used for trace element and toxicology testing? Option A. The tube contains a unique fast-acting liquid anticoagulant. Option B. The tube stoppers are specially manufactured to be free of trace element contamination. Option C. The tube is thicker to resist breaking in specialized centrifuges. Option D. The tube completely blocks out all infrared and UV rays. The correct answer is option B. The tube stoppers are specially manufactured to be free of trace element contamination. Royal blue tubes are manufactured to minimize trace element contamination from stoppers, glass, plastic, and additives. This is essential for toxicology and trace metal testing where very small contamination can alter results. The color does not mainly indicate light protection or faster anticoagulation. Question 63. When instructing a patient on how to collect a clean catch midstream urine sample, what is a key step? Option A. Voiding directly into the cup without any prior cleaning steps. Option B. Cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Option C. Saving all urine voided over a continuous 24-hour window in a refrigerated jug. Option D. Restricting fluid intake for 48 hours prior to voiding the sample. The correct answer is option B. Cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Clean catch midstream collection reduces contamination from skin and genital flora. The patient cleanses first, begins voiding into the toilet, and then collects the middle portion of the urine stream. Collecting the first urine directly into the cup increases contamination risk. Question 64. What should a phlebotomist do if they note a discrepancy between the patient's verbal name and the name on the pre-printed lab requisition? Option A. Change the requisition manually using a pen to match the verbal statement. Option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Option C. Draw the blood and sort out the labeling discrepancy later in the lab. Option D. Assume the patient knows their own name and print a new label on the spot. The correct answer is option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Any mismatch between the patient's statement and the requisition must be resolved before collection. Proceeding with unresolved identity information can create a wrong patient specimen and unsafe results. The phlebotomist should involve the supervisor, nurse, or ordering provider according to policy. Question 65. What is the maximum depth that a lancet should penetrate when performing a heel stick puncture on a newborn infant? Option F. 1.0 mm. Option B. 2.0 mm. Option C. 3.0 mm. Option D. 4.0 mm. The correct answer is option B. 2.0 mm. A newborn heel lancet should not penetrate deeper than 2.0 mm. This limit reduces the risk of striking bone and causing osteomyelitis. Deeper punctures are unsafe even if blood flow is difficult. Question 66. What type of consent is demonstrated when an adult outpatient rolls up their sleeve and extends their arm toward the phlebotomist after being asked for a blood draw? Option A. Expressed consent. Option B. Informed consent. Option C. Implied consent. Option D. Statutory consent. The correct answer is option C. Implied consent. Rolling up a sleeve and extending the arm after being asked to provide a specimen demonstrates implied consent. The patient's actions show cooperation with a routine procedure. Signed informed consent is a more formal process used when required by policy or procedure risk. Question 67. Which of the following tests evaluated the intrinsic pathway of the coagulation cascade and is used to monitor heparin therapy? Option A. Prothrombin time, patient. Option B. Activated partial thromboplastin time, APTT. Option C. Bleeding time test. Option D. Fibrin degradation products, FDP. The correct answer is option B. Activated partial thromboplastin time, APTT. APTT evaluates the intrinsic and common coagulation pathways and is used to monitor unfractionated heparin therapy. Heparin prolongs clotting activity measured by this test. Patient and INR are more associated with warfarin and the extrinsic pathway. Question 68. Which of the following practices helps ensure compliance with standard precautions in phlebotomy? Option A. Wearing gloves during all vascular access procedures and changing them between patients. Option B. Reusing plastic tube holders as long as no blood is visible on the outside surface. Option C. Washing disposable nitrile gloves with soap and water to extend their use. Option D. Placing used lancets into regular trash cans if they look clean. The correct answer is option A. Wearing gloves during all vascular access procedures and changing them between patients. Standard precautions require gloves for vascular access and glove changes between patients. This treats all blood and body fluids as potentially infectious regardless of known diagnosis. Reusing holders, washing disposable gloves, or discarding sharps in regular trash violates safe practice. Question 69. For which of the following tests must a phlebotomist use a grey top tube containing potassium oxalate? Option A. Erythrocyte sedimentation rate, ESR. Option B. Oral glucose tolerance test, OGTT. Option C. Activated partial thromboplastin time, APTT. Option D. Blood urea nitrogen, BUN. The correct answer is option B. Oral glucose tolerance test, OGTT. Oral glucose tolerance testing uses grey tubes when glucose stability must be preserved over time. Sodium fluoride slows glycolysis, while potassium oxalate helps prevent clotting. Coagulation, chemistry, and hematology tubes do not provide the same glucose preservation. Question 70. What type of legal charge can be filed if a phlebotomist discloses a patient's private medical details to a neighbor? Option A. Assault. Option B. Battery. Option C. Invasion of privacy or breach of confidentiality. Option D. Negligence. The correct answer is option C. Invasion of privacy or breach of confidentiality. Sharing a patient's private medical details with a neighbor is a breach of confidentiality and invasion of privacy. Health information may be disclosed only for authorized treatment, payment, operations, or with proper permission. Assault and battery involve threats or touching rather than privacy violations. Question 71. What is the function of platelets, thrombocytes, in the human body? Option A. Transporting carbon dioxide back to the pulmonary system. Option B. Producing specific antibody proteins to neutralize viral particles. Option C. Participating in primary hemostasis by aggregating to form a platelet plug. Option D. Maintaining systemic core body temperature variations. The correct answer is option C. Participating in primary hemostasis by aggregating to form a platelet plug. Platelets support primary hemostasis by adhering to damaged vessel surfaces and aggregating into a platelet plug. They also provide a surface for coagulation reactions that stabilize clot formation. Red cells carry gases, and leukocytes provide immune defense. Question 72. Which of the following parameters is most heavily altered if a potassium sample is hemolyzed? Option A. The potassium level will be falsely elevated. Option B. The potassium level will be falsely decreased. Option C. The sodium level will rise to compensate. Option D. The hematocrit level will drop below readable thresholds. The correct answer is option A. The potassium level will be falsely elevated. Hemolysis releases intracellular potassium from red blood cells into the serum or plasma. This produces a falsely elevated potassium result that can appear clinically dangerous. Sodium and hematocrit are not affected in the same direct way by red cell rupture in a chemistry sample. Question 73. What should a phlebotomist do if an outpatient becomes pale, sweaty, and complains of feeling dizzy before you insert the needle? Option A. Proceed quickly with the puncture before they pass out completely. Option B. Terminate the preparation, lower the patient's head or recline the chair, and provide a cool cloth or assistance. Option C. Instruct the patient to take deep, rapid breaths to hyperventilate. Option D. Give the patient a glass of hot water to drink immediately. The correct answer is option B. Terminate the preparation, lower the patient's head or recline the chair, and provide a cool cloth or assistance. Pallor, sweating, and dizziness before needle insertion suggest an impending fainting episode. Preparation should stop, the patient should be reclined or assisted safely, and symptoms should be managed before any draw attempt. Continuing may lead to syncope, falls, or injury. Question 74. Which of the following values represents a normal fasting blood glucose level for a healthy adult? Option A. 70 to 99 mg/dl. Option B. 140 to 180 mg/dl. Option C. 200 to 250 mg/dl. Option D. 300 to 350 mg/dl. The correct answer is option A, 70 to 99 mg/dl. A normal fasting glucose for a healthy adult is generally about 70 to 99 mg/dl. Values above that range may suggest impaired fasting glucose or diabetes depending on diagnostic criteria and repeat testing. The higher ranges listed would be abnormal and require clinical follow-up. Question 75. What is the target population for a GA3 card or newborn screening test panel? Option A, geriatric outpatients in nursing homes. Option B, infants up to a few days or weeks old. Option C, pregnant women in their first trimester. Option D, patients undergoing active chemotherapy treatments. The correct answer is option B, infants up to a few days or weeks old. GA3 cards and newborn screening panels are designed for infants shortly after birth. They screen for metabolic, endocrine, and genetic conditions that benefit from early detection. Adult, prenatal, or oncology testing uses different screening methods. Question 76. Which of the following conditions can cause a specimen to be rejected due to icterus? Option A, falsely high fats in the patient's diet. Option B, high concentrations of bilirubin in the serum or plasma sample. Option C, excessive destruction of red cells inside the tube due to rough handling. Option D, utilizing the wrong color top tube during collection. The correct answer is option B, high concentrations of bilirubin in the serum or plasma sample. Icterus describes a yellow to amber serum or plasma appearance caused by high bilirubin concentration. It can interfere with certain laboratory methods and may lead to rejection or result comments depending on severity. Lipemia and hemolysis create cloudy or red appearances rather than bilirubin-related discoloration. Question 77. If a phlebotomist notes that a patient has an active hematoma in the right antecubital area, where should they draw blood? Option A, distal to, below, the hematoma in the right arm, or use the left arm. Option B, directly through the center of the active hematoma swelling. Option C, proximal to, above, the hematoma on the upper right arm. Option D, from the foot on the same side as the hematoma. The correct answer is option A, distal to, below, the hematoma in the right arm, or use the left arm. An active hematoma contains pooled blood outside the vessel and should not be punctured. The opposite arm is preferred, or a site distal to the hematoma may be used if appropriate and permitted. Drawing through the swelling can contaminate the sample and worsen bruising. Question 78. What does the acronym PASS stand for in relation to fire extinguisher operation? Option A, pull, aim, squeeze, sweep. Option B, push, aim, slice, secure. Option C, pull, activate, squeeze, shake. Option D, press, aim, secure, sweep. The correct answer is option A, pull, aim, squeeze, sweep. PASS stands for pull, aim, squeeze, and sweep. This sequence describes the basic operation of a portable fire extinguisher. Using the wrong sequence can waste time and reduce effectiveness during a small controllable fire. Question 79. Which of the following tests is typically ordered to detect systemic blood infections or septicemia? Option A, complete blood count, CBC. Option B, blood cultures. Option C, erythrocyte sedimentation rate, ESR. Option D, C-reactive protein, CRP. The correct answer is option B, blood cultures. Blood cultures are ordered to detect microorganisms circulating in the bloodstream. They are essential when septicemia or bloodstream infection is suspected. CBC, ESR, and CRP can support infection assessment but do not identify organisms in blood. Question 80. What tube additive prevents clotting by binding or chelating calcium? Option A, lithium heparin. Option B, EDTA. Option C, sodium polyethylene sulfonate. Option D, thrombin. The correct answer is option B, EDTA. EDTA prevents clotting by chelating calcium, a required cofactor in the coagulation cascade. This makes it especially useful for hematology testing where cells must remain unclotted. Heparin inhibits thrombin activity, SPS supports blood culture recovery, and thrombin promotes clotting rather than preventing it. Question 81. Which of the following veins runs along the lateral, outer, aspect of the antecubital fossa and is considered the second choice for venipuncture? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, axillary vein. The correct answer is option B, cephalic vein. The cephalic vein runs along the lateral, thumb side aspect of the antecubital area. It is often considered after the median cubital vein because it may be less anchored or harder to access. The basilic vein is medial and closer to major nerves and arteries. Question 82. What color top tube is used to collect specimens for lead testing? Option A, tan or royal blue with EDTA. Option B, light blue. Option C, light green. Option D, yellow. The correct answer is option A, tan or royal blue with EDTA. Lead testing requires tubes certified to be low in trace metal contamination, commonly tan or royal blue with EDTA. Ordinary stoppers and additives can contaminate trace element specimens. Light blue, green, and yellow tubes are selected for different testing needs. Question 83. What type of isolation protocol requires healthcare workers to wear a gown, gloves, and use dedicated equipment to prevent spreading resistant GI infections like C. difficile? Option A, airborne isolation. Option B, droplet isolation. Option C, contact isolation. Option D, protective reverse isolation. The correct answer is option C, contact isolation. Contact isolation is used for organisms spread by touch or contaminated equipment, including resistant gastrointestinal pathogens such as C. difficile. Gown, gloves, and dedicated equipment reduce environmental spread. Airborne and droplet precautions target respiratory transmission routes. Question 84. Which of the following tubes contains an additive that preserves cellular morphology for a differential blood smear? Option of light blue top. Option B, lavender top, EDTA. Option C, gray top. Option D, green top. The correct answer is option B, lavender top, EDTA. Lavender EDTA tubes preserve cellular morphology for differential counts and blood smears. EDTA prevents clotting without causing major distortion of white blood cell appearance when smears are prepared promptly. Citrate, fluoride, and heparin tubes are not preferred for routine differential morphology. Question 85. What is the standard ratio of blood to anticoagulant additive in a light blue coagulation tube? Option F 1:1, Option B 5:1, Option C 9:1, Option D 10:1. The correct answer is option C, 9:1. Light blue coagulation tubes require a 9:1 blood to sodium citrate ratio. This ratio preserves clotting factor measurement without over-anticoagulating the sample. Underfilling the tube changes the ratio and can falsely prolong clotting results. Question 86. What is the primary reason for avoiding venipuncture on an arm with an active hematoma? Option A. The needle will cause the hematoma to spread to the opposite arm. Option B. The sample will be contaminated with hemolyzed, stagnant blood from outside the vein. Option C. The vacuum tubes will implode due to tissue density variations. Option D. It will cause immediate and permanent paralysis of the limb. The correct answer is option B. The sample will be contaminated with hemolyzed, stagnant blood from outside the vein. A hematoma contains pooled blood outside the vein that may be stagnant or hemolyzed. Drawing through or near it can contaminate the sample and worsen tissue injury. A different site, preferably the opposite arm, should be selected when possible. Question 87. What clinical complication can arise if a phlebotomist punctures the skin through wet alcohol? Option A. The needle will slip and miss the vein entirely. Option B. The red blood cells in the sample may hemolyze, ruining the specimen integrity. Option C. The patient's blood pressure will drop rapidly. Option D. The vacuum inside the collection tube will increase significantly. The correct answer is option B. The red blood cells in the sample may hemolyze, ruining the specimen integrity. Puncturing through wet alcohol can introduce alcohol into the specimen and irritate the site. It may contribute to hemolysis and can cause a stinging sensation for the patient. The antiseptic must air dry completely before needle insertion. Question 88. Which of the following additives is present in a light green top plasma separator tube, PSD? Option A, sodium heparin and a gel barrier. Option B, lithium heparin and a gel barrier. Option C, DDTA and a gel barrier. Option D, clot activator and a gel barrier. The correct answer is option B, lithium heparin and a gel barrier. Light green PSD tubes contain lithium heparin and a gel barrier. Lithium heparin prevents clotting, and the gel separates plasma from cells during centrifugation. SST tubes contain clot activator for serum rather than heparinized plasma. Question 89. Which of the following additives is used to preserve glucose stability by preventing its breakdown by red blood cells? Option A, sodium citrate. Option B, sodium fluoride. Option C, lithium heparin. Option D, ammonium oxalate. The correct answer is option B, sodium fluoride. Sodium fluoride preserves glucose by inhibiting glycolysis in blood cells. This slows cellular consumption of glucose after collection. Citrate, heparin, and oxalate alone do not provide the same glycolysis inhibition. Question 90. What is the maximum acceptable delay time for separating serum or plasma from cells for most routine chemistry tests? Option A, 30 minutes. Option B, 2 hours. Option C, 4 hours. Option D, 8 hours. The correct answer is option B, 2 hours. For many routine chemistry tests, serum or plasma should be separated from cells within about 2 hours. Delayed separation allows cells to consume glucose and release or exchange analytes. Excessive delay can produce inaccurate results even if the collection itself was successful. Question 91. Which of the following tests must be kept warm at body temperature during transport to the laboratory? Option A, cryoglobulins. Option B, ammonia. Option C, lactic acid. Option D, free fatty acids. The correct answer is option A, cryoglobulins. Cryoglobulin specimens must be maintained at body temperature until processing because the proteins can precipitate when cooled. Warming prevents premature precipitation that can alter test results. Ice transport is used for analytes such as ammonia or lactic acid, not cryoglobulins. Question 92. When centrifuging specimens, what is the most important operational rule to follow? Option A, centrifuging serum tubes immediately before they clot. Option B, ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Option C, leaving the lid open slightly to prevent overheating of the tubes. Option D, setting the speed to the maximum RPM regardless of tube type. The correct answer is option B, ensuring the centrifuge load is balanced by placing equal volume tubes opposite each other. Centrifuge tubes must be balanced with similar volume tubes opposite each other. An unbalanced load can damage the centrifuge, break tubes, and create aerosol or biohazard exposure. Opening the lid during operation or using maximum speed without regard to specimen type is unsafe. Question 93. Which of the following is an example of a vector-borne transmission? Option A, contracting a cold from an airborne sneeze. Option B, acquiring a skin infection from a contaminated countertop. Option C, getting bit by a mosquito infected with West Nile virus. Option D, drinking water containing bacterial toxins. The correct answer is option C, getting bit by a mosquito infected with West Nile virus. Vector-borne transmission involves a living carrier that moves an infectious agent from one host to another. Mosquito transmission of West Nile virus is a classic example. Airborne droplets, contaminated surfaces, and contaminated water represent other transmission routes. Question 94. What should a phlebotomist do if a patient experiences a sudden, sharp, shooting pain down their arm during a venipuncture? Option A, advance the needle deeper to see if the pain stops. Option B, terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Option C, tell the patient that minor discomfort is completely normal for this vein. Option D, instruct the patient to keep their arm completely still while you finish filling the tube. The correct answer is option B, terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Sudden sharp shooting pain down the arm suggests possible nerve contact. The venipuncture should be terminated immediately, the needle withdrawn, and the patient assessed according to policy. Continuing or redirecting the needle can worsen nerve injury. Question 95. What type of consent is assumed when an emergency department patient is unconscious and requires immediate life-saving laboratory work? Option A, expressed consent. Option B, informed consent. Option C, implied consent. Option D, verbal consent. The correct answer is option C, implied consent. Emergency implied consent applies when an unconscious patient needs immediate life-saving care and cannot provide permission. Necessary laboratory work may proceed under facility policy to support urgent treatment. This differs from routine outpatient cooperation or signed informed consent. Question 96. What is the correct action if a phlebotomist cannot find a suitable vein in either of the patient's antecubital fossae? Option A, probe blindly in the area where the median cubital vein should be located. Option B, inspect the dorsal aspects of the patient's hands for accessible veins. Option C, attempt a venipuncture on the inside aspect of the patient's wrist. Option D, draw blood from a vein located on the anterior aspect of the lower leg. The correct answer is option B, inspect the dorsal aspects of the patient's hands for accessible veins. If antecubital veins are not suitable, the dorsal hand veins are the usual next site to inspect. They require careful anchoring and often a smaller device because they are more fragile. Blind probing or using wrist and lower extremity sites increases risk and may require special approval. Question 97. Which of the following parameters is most heavily impacted if a phlebotomist squeezes or milks a finger during a capillary puncture? Option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Option B. The blood flow will stop completely due to arterial vasoconstriction. Option C. The platelet count will become falsely elevated beyond high limits. Option D. The glucose values will drop to zero within seconds. The correct answer is option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Milking a finger forces tissue fluid into the drop and can rupture cells. This dilutes the specimen and may cause hemolysis or inaccurate results. Gentle warming and proper puncture technique are preferred ways to improve blood flow. Question 98. Which of the following conditions can cause a specimen's serum to appear bright red or pink after centrifugation? Option A, lipemia. Option B, icterus. Option C, hemolysis. Option D, hemoconcentration. The correct answer is option C, hemolysis. Hemolysis releases hemoglobin from red cells and gives serum or plasma a red to pink color after centrifugation. It can also falsely alter potassium, LDH, ASD, and other analytes. Lipemia appears milky, and icterus appears yellow to amber. Question 99. Which of the following parameters can cause a false elevation in a patient's serum bilirubin level? Option A, exposing the specimen tube to direct room light or sunlight for an hour. Option B, ensuring the specimen is kept away from light by wrapping it in foil. Option C, centrifuging the specimen within 30 minutes of collection. Option D, collecting the sample from a fasting patient. The correct answer is option D, collecting the sample from a fasting patient. Fasting can increase serum bilirubin in some patients by altering bilirubin metabolism and hepatic handling. Light exposure usually lowers bilirubin by photodegradation, so it would not cause a false elevation. Proper bilirubin handling includes following preparation instructions and protecting the specimen from light. Question 100. What is the liquid portion of an anticoagulated, centrifuged blood specimen called? Option A, serum. Option B, plasma. Option C, whole blood. Option D, fibrin clot. The correct answer is option B, plasma. Plasma is the liquid portion of anticoagulated blood after centrifugation. It contains clotting factors because clot formation has been prevented. Serum comes from clotted blood and lacks fibrinogen and many clotting factors.